This is Fox 45 Morning News.
8:15, a new year, really a new you. This morning's Makeover Monday is taking a look at cosmetic procedures, both surgical and non-surgical, with Dr. Nadia Mostovych.
Yes.
Yeah, so right here, she's from Belcara Health here. We were just talking a little bit more about why this time of year is so popular, and you made it simple and made it seem like, okay, well, surgical procedures happening in the winter because of a certain number of lists. To list them off real quick. Why
yeah, exactly. So there's a couple different reasons. I always tell patients one of the most important reasons winter is best is because there's less risk for sun exposure.
Okay.
And after surgery, it's really important to minimize your exposure to the sun, especially with certain procedures like chemical peels, because the sun's damaging rays can actually have an even greater effect on freshly treated skin.
Okay, so then let's talk about the range. You were just talking about chemical peel, which is more of a topical procedure here. And then you can also be a little bit more invasive on other procedures.
Correct.
And then scheduling for you right now, depending on the procedure, how long out, or are you booked right now solid?
No, we're booking about a couple weeks out. You know, it depends, but there's definitely opportunities to get in still for the winter.
And the most popular for Baltimore area procedures that are being done here?
You know, some of the most popular procedures are eyelid lifts, facelifts, and rhinoplasty, I would say.
Okay, and then, but that right there, okay, so people are saying new year, new you. Are you seeing that, or is it really more about the recovery?
I think that's part of it. You know, I think when the new year hits, people start to think about, you know, prioritizing themselves, self-care. Maybe there's been something they've always wanted to do for themselves, and it's a good time of year to kind of make that jump. If
I was a patient, I would come to talk to you about it, though. How long of a procedure? Do we have a sit down and interview first before, you know, and how long before the knife actually makes the cut, shall we say? Yeah,
good question. So yes, I have an hour-long consultations with all of my patients. We do that at Belcara Health, and we prioritize the patient. We want to make sure we understand their goals and their needs. So that first hour is probably the most important part of the entire process. Okay. Okay, and then after that, we have a good, you know, I'll talk with the patient. We'll get a good understanding of what they're looking for, and then we sit down and schedule some options. And depending on the procedure, you know, we might need to be able to do some things ahead of time, make sure that their health is, you know, appropriate and on par with getting the procedure. And other things are smaller, and we can do them on a quicker basis.
And then, have you ever had to tell somebody you really don't need that, and that's actually could be more dangerous if you do get that procedure than what you have right now?
Sure, that's another good question. So I think, you know, a lot of it is talking about expectations with patients. Patients often come in and they think, oh, I want this procedure. They hear about it on TV or on the media, and it's our job at Belcara Health to educate patients. That's one of the things we pride ourselves in. And so to make them understand what's a good procedure for them and what they're looking for, and maybe what procedure could give that to them. But yes, obviously cosmetic procedures are elective procedures, and your health is most important. And so we do want to make sure that people aren't, you know, pursuing something that would be unsafe for them.
Dr. Nadia Mostovych, thank you so much. We appreciate your time right there.
Thank you so much.
New you right here.